Hi, I'm Shelley Argabright, Health Strategist for Garrett County. And today I had the opportunity of giving this presentation to the Robert Wood Johnson Foundation's Data Work Group. So I'm going to go ahead and give it to all of you. The first thing that differentiates us and our platform from other platforms is the approach that we've taken. Instead of starting with data, we started with the people and eventually intersected the two. Most tools are data-centered and have little to no community engagement. But we flipped this notion because we believe that each and every individual in our community is valuable, is on a journey, and has a story that really matters. From a public health perspective, as we look at moving population health indicators over time, we really need to consider what it takes to get us there. It begins with honestly evaluating where we are as a field with data, and then understanding that real change will not happen without community buy-in, regardless of the amount of data we have. My colleague and I had just built and launched our first version of mygarrettcounty.com when we applied for the Culture of Health Prize. That was 5 years ago already. So after our community won the Culture of Health Prize, we were awarded an innovation grant and then a second to replicate our platform across the country from our WJF to ensure that the platform stayed free and is 100% open source. We also received a model practice from NACCHO, and here's where we are today. We have 2,359 planning partners in a rural community with a population of 29,000 people. We are tracking 1,008 local data points, most on a monthly basis by our planning partners, and that's spread across 197 different topics, categorized in what we've coined as action groups. With 622,802 page views, it's a pretty popular site. Of course, we know that community collaboration is the best way to be successful, so we designed this tool so that agency stakeholders and community members can utilize together and then mobilize around a common purpose. Here's an example of the Child and Adolescent Wellness Group. It's a topic that has brought a wide variety of partners and community members together. I'd like to point out in this screenshot of the action group that there are 48 different members who are engaged. The group is led by a community volunteer named Carl, who happens to be a retired OB/GYN. Clearly, he resonated with this topic and wanted to do something more in our community. So his story continues. He recruited physicians' offices, the Board of Education, and many community members. Also in the screenshot, you'll see the description explains the purpose, and this particular action group has a goal to increase well child checks. That's an indicator that Maryland reports. It allows us to compare ourselves to other counties in Maryland. Unfortunately, Garrett lags behind and has often been the worst in the state. So, can we as a community take the state level indicator and justify that the strategies that we're employing in this particular action group are making a difference? Keep thinking about that question as we move through. Look again, and you can see the faces of the people who are working on this project, emphasizing that the Garrett County Planning Tool is person-focused with transparency and accountability built in. You'll see Carl and a representative from 3 different physician offices that are pictured. We also have our deputy health officer pictured. They basically have access to enter their data each month on how many well visits are completed in each practice, just to find a baseline. There are several strategies that they are working toward, but I have to move on. The second example centers around what I hope is now standard practice at all health departments and can be a vital life-saving effort, and that's Narcan distribution. When we think about the things that are needed in local communities to move our population health indicators that are related to data, there are 3 key elements: transparency of organizations, and the access that we offer to other agencies, and then combining those two so that community can interact and engage with the data on different levels. We really do need all 3 to begin shifting toward measuring impacts and utilizing the data that we have with the goal of program attribution. without taking the major leaps. And the third is a screenshot of another action group called Overdose Response Training. This screenshot is just a little bit deeper into the action group. What you're looking at is the chart. So it's where local data points are collected and viewed. This raw data is in every action group so that any group has the ability to track measures if they want to. It also means that anyone can view the data. The next slide is a busy one. Here we're tracking 11 different measures, and this is a screenshot of a responsive visualization that's automatically generated based on the data that's entered and displayed. And it's really, it displayed in every possible way in our performance management dashboard. So the fields can be turned on and off easily inside the group, making this chart a little bit easier to use. And the 11 measures that they're tracking are the number of trainings, the units dispensed by month, and they're actually training a running total, new participants, recertified participants, the number of instructors trained, the number of fentanyl strips distributed, and the visualizations are from the start of data collection. So this particular group began in 2017, and they can be viewed by calendar or fiscal year to the present. So the next example is centered on health equity, and it's an effort that is spun off of our work with the Garrett County Planning Tool and is brand new. This is one of my favorites because of what we're learning about the population and that we're able to give everyone access to high quality program. It's health equity that's demonstrated on a ground level. We did develop this concept during lockdown, and it has been a tremendous success. It's a programmatic example, and it was designed to really cultivate compassion with an aim of elevating others, making connections, supporting local business, and measuring well-being as a new approach to addressing chronic disease prevention, especially diabetes. It launched in December of 2020, so it was still a pretty intense time during the pandemic here. The screenshot of the program found at gogarrettcounty.com. Now remember, this is a spinoff and it's different than the Garrett County Planning Tool. It does, however, have an action group on mygarrettcounty.com to track some progress. But what I wanted to really show you are examples of a few of the vlogs that are generated on the actual program site. The content is entirely generated by local community members and local professionals who specialize in fitness, nutrition, mindfulness. The topics range from weight loss to creating a relaxation response. So of course, we've been collecting data and asking standard demographic questions, but we've also expanded that to include questions about belonging and other questions to begin to measure well-being. We've learned from some micro-sampling efforts collected on gogarrettcounty.com. Right now, it's 180 surveys, that a large portion of our participants don't consider themselves, quote, unhealthy, although their reported BMI, their activity level, and diet classifications would indicate otherwise. So by approaching chronic disease more broadly, leading with well-being, it naturally makes the program more inclusive. Creating resources available to everyone and delivering vetted health messages make it more palatable for many to discuss chronic diseases who are not yet ready to acknowledge that they may be at risk for pre-diabetes, for example. For others who are in different stages of behavior change, the program creates ease and accessibility to the existing diabetes management programs in the county. Here's a screenshot of the participants who have chosen to complete the survey. The one on the right of the screen is income level. So those who can't afford to pay for nutrition or fitness coaching usually get left out, but not this time. In this program, we are serving people who are reporting making over $150,000 a year, and in the same place, those who make $15,000 or less a year. I would love to have the time to dig a little bit deeper into this, but look at the chart on the left. Only 4 people say that they don't have the financial resources to live a safe and healthy life. Only 4. On the other chart, there were 15 participants who reported making $15,000 or less. So this is striking to me. So the next question is obviously, what does living a safe and healthy life mean? So we're jumping out of the scope of this presentation, but it is a fascinating finding and something that we hope to look a little bit more. Here are a few ways that we're going beyond and expanding our scope. The first way is that we're going to begin collecting referrals and tracking those referrals utilizing the well-being program that I just mentioned on the platform. It's a definite beta testing adventure, but be watching for future integrations. The second will be a major release to our open source portfolio this summer, as we've begun working with the community champions to take those 1008 hyperlocal data points and ensure that most of them are paired with a strategy and a time frame target within the planning tool. This is very exciting. That leads us to our lessons learned. Again, this is from our unique approach at putting people first and finding out what's important to our community, utilizing a tool that's built specifically for public health, and it incorporates data at all levels. This is a hands-on endeavor, and it requires a lot of time with community members and agency stakeholders. At every encounter, it's necessary to ask questions about measurement. There are so many good ideas at coalition meetings, but how all of those good ideas will be measured, and if they are part of a strategy that'll help us get to our goal, these are all questions and efforts that keep us on track. We want to empower so people don't lose heart. So finding the benefit for them and understanding their purpose helps the health strategists and accreditation coordinators and others like me to just really back off a bit, because we don't want to be prescriptive and we need to find a way to balance the work. There may be projects or opportunities that the coalition is really interested in working toward, but it might not necessarily have anything to do with the goal at that particular time. So like any good relationship, it's about compromise and the gentle reminders. So keeping us on track is public health, and it is really helpful to have some structure. Public health does love boxes, and that's a good thing in this case. We need to demonstrate linkages through accreditation and systems from the field. So examples of creating a CHA and a CHIP are really helpful and provide those needed guidelines. Funding requirements that use data and encourage timeframe outcomes also tie everything together and are very helpful. Public health does not use data like e-commerce. This isn't Uber or Airbnb who drive rates to make money based on data. It takes so long for us to demonstrate change. So it's important to chunk it and show incremental progress over time. The sheer amount of data that we have is prolific, but is it the data that we need? Has anyone stopped to think about how we can show incremental change as we are achieving improvements in our population health outcomes? Can we all begin to innovate around the type of data that we might want to collect in order to be able to answer the questions that we really care about? This brings us full circle. We start with the people and what they care about. So in closing, I don't think I can reiterate this point enough. We need access to data for all levels of community and multiple touch points to interact with the different types of data. And finally, the song that we love to sing in Garrett County is open source. So we want to make sure that we invest and encourage open source tools for every community, like the Garrett County Planning Tool that is 100% free and available to everyone. So thank you for your time today.